Welcome to the lung page. Today we are going to see part 3 of the rapid revision of the chest X-ray. 5 images in 5 minutes. Okay. Case number 11. 56-year-old patient presented with severe abdominal pain and underwent the laparotomy. So after laparotomy, we took a chest X-ray. So we all know what are the findings of this chest X-ray. Very quickly we can see, you can see here, under the diaphragm, there's a gas is there. Under the diaphragm, this gas is there. This is called air under the diaphragm. Okay, what is that called? This is called air under the diaphragm. And also you can see the CV line. So what are the causes of air under the diaphragm? So we all know there is a air under the diaphragm causes are mainly interstitial obstruction lead to interstitial perforation. These are the main causes of uh, air under the diaphragm, and also patient underwent laparotomy. After surgery also you can get this air under diaphragm. So this is called pneumoperitoneum or air under diaphragm. So the diagnosis of this chest X-ray is air under the diaphragm, pneumoperitoneum. Okay, it's very easy chest X-ray. So here 29-year-old lady presented with shortness of breath and voice changes for 1 year duration. During the examination found to have irregular pulse. So how can you explain this chest X-ray? You can see, we all know airway is normal, bone normal. You can see the cardiac contour. There is an enlarged heart is there. Okay, so cardiomegaly is there. Okay, so this is cardiomegaly, and also you can see the diaphragm is normal and no effusion. Lung field, everything is normal. Okay, so what is the diagnosis? When you see this cardiac shadow, I almost always told like this. You can see this is a right atrium. This is a left atrium. There is no right ventricle visible in the chest X-ray. You can see, and also you can see massively enlarged heart. Okay, so patient with irregular pulse and voice changes. So these are the history. So double heart shadow, and also you can see a straight heart border. You can see clearly here. This is a pulmonary artery. Okay, this is a pulmonary artery. So what is your diagnosis here? Double heart shadow, straight heart border, and a prominent pulmonary artery. So according to the history, irregular pulse, this is most likely of diagnosis of mitral stenosis. When you encounter this type of chest X-ray, mitral stenosis is a first diagnosis. Mitral stenosis, there's a double heart shadow and straight heart border with prominent pulmonary artery due to pulmonary hypertension. So why this patient have a voice changes? Because of this enlarged left atrium obstruct or compress the recurrent laryngeal nerve. That's why this patient lead to voice changes. Okay, now clear? This is double heart shadow mitral stenosis. Okay. Another case scenario is 30-year-old female presented with cough and constitutional symptoms for 3 months duration. So this is a chest X-ray. You can see, as we all know, airway normal, bones normal, cardiac completely normal, diaphragm normal. There's no effusion. Okay, lung field, everything is normal. Okay, so the problem is here what? Obviously in the hile area. Okay, so problem is in the hile area. You can see these are the hilar prominence. Okay, so this is called hilar lymphadenopathy, bilateral hilar lymphadenopathy are there. So we all know what are the causes of bilateral hilar lymphadenopathy. We all know. So this patient constitutional symptoms. So lung field is completely normal. So the most likely diagnosis is sarcoidosis. Sarcoidosis is a common cause of bilateral hilar lymphadenopathy. Okay, other than lymphoma or malignancies. So if you see unilateral, you have to think about the infective origin such as TB. Okay, this is a diagnosis of bilateral hilar lymphadenopathy. Okay, so another chest X-ray challenge. 32-year-old lady presented with constant back pain for 6 months duration. So we took a chest X-ray. So here, as we all know, ABCD order, everything is normal. We all know there's a prominent lesion here. Okay, so what do you think? So within this lesion, there's no speculated. There's a well-shaped rounded lesions here in the mediastinum. Okay, within this lesion you can clearly visible the hilar structures. You can see bronchus visible and bronchial artery visible. Everything is visible. This is called hilar overlying sign. What is that called? Hilar overlying sign. So we have to know what are the causes of hilar overlying sign. Hilar overlying sign usually visible, usually seen in the mediastinal tumors or cardiomegaly or hilar lymphadenopathy or hilar area any prominent is there, you can see in the hilar overlying sign. So we took a chest X-ray lateral view. So we have to, what is our differential diagnosis? It may be anterior mediastinal tumor or posterior mediastinal tumor or sometimes in any other lymphadenopathy. So we took a lateral view. You can see clearly here is a lesion in the posterior mediastinal tumor. So we all know what are the causes of posterior mediastinal tumor. Usually posterior mediastinal tumors and neurological origins, neuroma, xenoma, sarcoma, those things. So here this is hilar overlying sign with the posterior mediastinal mass. Okay, now clear. So another case is case number 15. 60-year-old lady presented with fatigue and chest pain for 6 month duration. So history, very important thing is fatigue. So we took a chest X-ray. We all know problem is in the here in the mediastinum. We all know. Okay. So you can see the mediastinum there is a lobulated mass-like lesions are in the mediastinum, and also you can see very clearly in the mediastinal structures or hilar structures over this mediastinal mass. So this is called hilar overlying sign. So you suspect this type of hilar overlying sign. I told previously this anterior or posterior or sometimes is lymphadenopathy or whatever. There's a mediastinal mass-like lesions are there. So for the confirmation we took a lateral. So you can see here lateral view. So what is the lateral problem? Lateral chest X-ray retrosternal space should be in the black color. Here you can see the white color or dense areas there. So it's most probably anterior mediastinal tumors are there. So what are the causes of anterior mediastinal tumor? Anterior mediastinal tumors 40. We all know. What are those? Teratoma, terrible lymphoma, retrosternal extension of thyroid gland, and also thymoma. So 60-year-old lady with fatigue. So most probable diagnosis thymoma. Okay. So this history is anterior mediastinal mass, the chest X-ray finding. Okay. Now clear.